Okay, welcome to the last part of this new Placer 1 lecture. Okay, as we have already done all this before, now we are going to the part 2 of the hallmark of cancer. Okay, as we have discussed previously, the hallmark of cancer is basically fundamental changes of in the cell physiology in cancer cells. So in part B, we are going to look into four more hallmark. Number one is invasion and metastasis. Number six is altered cellular metabolism. Number seven, sustained angiogenesis. And number eight, evasion of immune surveillance. Okay, and of all four, this is the most important thing that you need to focus on. Okay, in invasion and metastasis, as I already mentioned in the part 1 lecture, invasion and metastasis is a very important hallmark or feature of malignancy. Okay, so what does it involve in invasion metastasis? It involves three main process: invasion of extracellular matrix. Number two is vascular dissemination as well as homing of tumor cells. And the fourth one is the metastasis that occurs in the other organs itself. Okay, in invasion of extracellular matrix, the process is very easy. Basically, in a normal cell, there's actually cadherins that controls the attachment of the cells. But the first thing that happen is loosening. What happened in loosening is actually the E cadherin does not work. Okay, that's the reason why in some cancers the E cadherin expression is actually very weak. So what does it mean? There is actually separation from one cancer cells to another cancer cells. Okay. Second thing, what happens is the degradation of ECM. Who produced the material to degrade the ECM? The one that produces it is actually the cancer cell itself. So these cancer cells will produce type 4 collagenase. Okay, and this type 4 collagenase as well as matrix metalloproteinase will go into the basement membrane. And what does it do? It actually cleavage all this collagen and protein in the basement membrane. And the last part, after he has cleavage or the basement membrane, this cell will start to move. How does it move? It move almost like a bacteria move along a tissue. I mean, it has the pseudopods features depending on the help with fibronectin, as well as the autocrine motility factor that produced by the cell itself, meaning that the cell produce a factor to make sure that they themselves move along in the stroma of the cancer cells. Okay, cancer tissue, sorry. Next is vascular dissemination. Okay, first what happened is the tumor already invade into the stroma. Okay, then what happened is the blood vessel nearby to this nearby the tumor will start to grow inside the tumor cell. Okay, and then what happened is there will be seedlings of the tumor cells inside the blood vessels, new blood vessels, and this will then move along the blood vessels in the blood. And this is all helped by the factor number 7 of the hallmark of cancer, which is sustained angiogenesis. I will tell that you later. Okay, so how do they go to specific organs? Okay, this depends on the homing of tumor cells. Okay, so from the primary tumor will go into the blood vessel. And what happens in the circulation, majority of the cells does not just disseminate by itself. Majority of it are clumped together. Then that's the reason why we call it as tumor microemboli. Okay, so this tumor microemboli is the one that is potential, then later on it will release itself from the platelet and it will attach to the endothelium of the other organ. So this is one organ, and this is organ number 2. Okay, so what are the factors? Number one, in lung cancer and liver cancer, why they are among two most common area of metastasis? It is because of the anatomic location, meaning that it depends on the first capillary bed. Okay. Um, Example, a breast cancer in the breast. Okay, there's a breast cancer. Almost all cancer, the thromboemboli will go into the venous system, and as you notice just now, in this diagram, the venous system will definitely go into the lung. Okay, so when it goes to the lung, that is actually the first capillary bed that it goes to. Okay, and that's the reason why lung is actually one of the location of metastasis. In liver, because majority of the cancer are actually from the GIT. This is because you can actually there's actually two circulation in liver. One is the main circulation, and there's a portal circulation. This portal circulation, what does it do? It actually all of this will go into the liver. Okay, because as you might remember, all these nutrients will go into the liver to be processed first before it goes into the body. So basically, any tumor from here or even here will go into the liver first, and that's the reason this is actually the first capillary bed that will receive the tumor from any of the primary locations. Um, in term of another factor that is important for in term of homing is what does this particular organ produce. Okay, each of these organ produce this protein. Okay, and this protein depends on which example is one. There's one particular tumor, they produce certain cells, and these cells have affinity to this protein, and that's the reason why it goes into the bone. Example, another tumor that has affinity to this particular protein, and it goes into the lung. Example, another tumor has affinity to COX-2 protein, then it will go to the brain primarily. Okay, so the expression of addition molecules is also important in terms of the tropism. Where does the metastasis go? And another one is actually because of the tumor expressing chemokines. The tumor itself produce chemokines. This is all chemokines, and these chemokines are the chemokines that actually makes it attached to a particular organ. Okay, right. And after it goes, as I showed you to you before, after it goes into the blood vessels, it attaches to many addition molecules, and then later on, what will happen is it will start to attach to the addition molecules in the endothelium before it starts to go into transmigration, almost similar to what happened in acute inflammation process. Okay, so it's not that difficult. Okay, and vascular permeability also occurs in the distant area of the metastasis. Okay, this is important because what happened is when the tumor cells arrive to the organ number 2, it does not directly cause tumor. What does it cause? It causes pre-metastatic niche, meaning that there's actually a tumor cells with other stromal tissue of the cells. This is important. This stromal tissue of organ number 2 is the one that makes it easier to for the tumor cell to grow there, or make it hard to grow there. Okay, and later on this niche become micrometastasis, and later on it become a big macro colonization as you see in the previous slide before. Okay, and in summary, okay, this is what the diagram that you can actually look into textbook, and you can actually see all the process that I've told you before, from the very first part to the what happened in the blood vessel, as well as what happened later on. So this 1, 2, 3 process. Okay, so that's all about invasion and metastasis. Number 6 is regarding altered cellular metabolism. There's 3 main things: Warburg metabolism, autophagy, and oncometabolism. Warburg metabolism is basically a metabolism that occur when there is actually lack of oxygen. Okay, in normal cells, okay, there is also Warburg metabolism. In normal cells, basically when there's actually oxygen with glucose, okay, it will produce pyruvate, and it goes into TCA cycles, and this produce I think along 30 plus ATPs. Okay, however, sometimes, but very few of them will have no oxygen. It goes into anaerobic glycolysis, okay, and produce pyruvate and lactate. Okay, In neoplastic cells, it does not matter if they have oxygen or not. The most important that they need is just glucose. Okay, and because neoplastic cells usually is not in one or two, is many of them, and so usually blood vessel is very scarce. Sometimes there's no blood vessel to them, so the majority of them will go into no oxygen status. And what happen is it will definitely go into this pathway. Okay, it will go into this pathway. Okay, even though what happened is they only produce only 4 ATPs. Okay, it does not matter, because what happened is what they want is actually this lactate, because this lactate will produce more and more and more cells. Okay, another problem that can occur in cancer cells, in normal cells, when they start to have no energy, cells will start eat up their own material inside the cytoplasm, either mitochondria, protein, or other cytoplasmic components. They will start to eat up, and then they produce the energy. But part of the complication, or part of the process, is it will go into cell death. Okay, so this is what cancer cell does not want to. They don't want to go into cancer cell death. So what they do is actually they affect all this process, and they will start to block it. Okay, they blocked it. So what happened is all the cancer cells does not go into cell death, and this death. So it means that the cells that will example, as I see to you in the previous lecture, the old cells will stay there, and the new cell will grow and will form a tumor. Okay, so autophagy is very important. Oncometabolism is actually quite easy. You might remember in cell there's Krebs cycle. This is Krebs cycle, and there's actually an enzyme called isocitrate dehydrogenase. Okay, they use this example because isocitrate dehydrogenase is actually an enzyme needed for this Krebs cycle to occur. But what happened is, in a normal situation, there is actually some inhibitors that can work to make sure that the process does not becomes too much. So in a mutant IDH, what does it do is basically freely will cause changes of production of oncometabolites, and these oncometabolites basically will cause more proliferation of cells. Okay, as easy as that. Okay, and number 7 is on sustained angiogenesis. Okay, tumor cells is actually a very actively growing cells. Okay, and it needs everything, nutrient and oxygen. So what does it need? It needs a supply. So what does it do? In growth of blood vessels, there's always promoter, a pro of growth, okay, and anti of the growth of the blood vessel. Okay, so when it comes to tumor cells, the pro become more. Okay, and especially in a tumor that is well established, more promoter of blood vessel growth or angiogenesis occur. Okay, angiogenesis means that new blood vessel. I believe you have learned that in wound healing lecture. So what are the factors that affect the angiogenesis? Hypoxia is number 1, tumor suppressor genes is number 2, and the RAS and MYC function mutation. In hypoxia, what happened is all the tumors, as I say to you before, when they grow, they are very high growing, but the supplies sometimes could not meet the demand. So they go into hypoxia. When they go into hypoxia, they will induce angiogenesis factor. One of the angiogenesis factor is actually VEGF, and this VEGF will cause the growth of the blood vessel inside the tumor. Okay. Number 2 is the tumor suppressor genes. As you might heard it before, this P53 is supposed to be the one that inhibit these factors to make sure that the growth does not happen. Okay, and at the same time, this P53 also produce these factors. This P53 is supposed to be the one that inhibit these factors to induce blood vessel growth, but this p53 also produce these factors to inhibit the growth. Okay, so in tumor cells, what happen is there's mutation of p53. So when there's a mutation of p53, there's no inhibition. So the VGF, HIF will just work and work and work and work, and there will be more blood vessels. At the same time, there is no inhibition at all from the product that's stated here. So that's the reason why the tumor suppressor genes is actually useful in terms of giving the tumor more blood vessels. And the last one is the immunity, evasion of immune surveillance. Immunity towards cancer, basically cancer is considered as foreign in human body. So what happen is, first cancer cells will release antigens. Antigens will go to the antigen presenting cells in the lymph nodes, and then they will then produce the immunity towards the cancer. So basically, in normal sense, the cancer cells can be killed by the immune cells in the body. However, there are some techniques that cancer cells do. Okay, these are the evasions, what they do to make sure that they do not get the attack from these immune cells. The first thing that they do is actually they just completely lose antigenicity. Tumor cells basically has these cells that have antigenicity. They have an antigen that can actually make the antibody to attach and attack it, cause inflammation. But there's no antigen. No antigen, meaning that they just live. Okay. Another thing is actually the antigen sometimes that they produce is actually antigen does not work with this antigen. Okay, so they basically produce an antigen that has no affinity to the antibody. So this process does not work as well. And even better, what they do is actually they themselves produce the protective mechanism. They produce some sort like a shield to actually inhibit the immune cells to attack them. So these are the 1, 2, and 3 tactics that they use to make sure that the immunity does not cause death to them. Okay, all right. I think that's all about the hallmark cancer. Then the importance of knowing this is because if you look in the textbook, of all the 10 hallmarks of cancer, each of them has its own target for treatment. Okay, example, as I say to you just now, EGFR is actually one of the main factors for the proliferating, and what they do is just they produce an EGFR inhibitors. Okay, as well as the growth suppressor CDK just now. What they do is they produce inhibitors. Okay, so this is how they plan for treatment. That's the reason why you need to learn the biology of the tumor cells, because you need to understand the treatment that the patient is getting. Okay, and apart from that, the most then we have finished all this all this part in the lecture of neoplasia 1. But the most important and importantly, later on you will go into other part in the lecture of neoplasia 2. But the main goal, okay, the main goal of you to know all of this is because of these people, okay, and not far away that happen in our country, as well as some of our heroes. Okay, these are the people that are afflicted with cancers. And apart from you knowing the signs of it, you need to know about their story. Okay, I hope you can go into YouTube, just Google cancer story. There's a lot of them, and it doesn't take that long, about 5 minutes for you to listen to all the cancer story. And sometimes you can actually listen all the things that they tell, the progression, how the tumor bleeds, and all those things. Okay. With that, I leave you with this. As you may have noticed, there's a lots of ribbons that we've seen before, but majority of the ribbons are basically built to remember the cancer survivors as well as the cancer fighters. Okay.